Meantime, I want to tell you the U.S. now issuing a new warning, says do not travel to China. The State Department raising the alert level after the WHO declared the coronavirus outbreak a public health emergency. Joe, with color commentary,
sorry,
that makes a lot of sense.
Well, sure, we were arguing with that guy earlier this week about it. It was like, oh, it's okay to travel for tourism.
Not so much. Overnight, the death toll rising from the virus past now 200. The number of confirmed cases worldwide, 10,000. There are now 6 confirmed cases officially in the United States. And earlier this morning, the United Kingdom reported its first 2 cases of the virus as well. We want to get to Eunice Yoon right now, who's on the ground in Beijing with a look at what it's like living in China as the outbreak worsens. Good morning to you, Eunice.
Hi, guys. People are slowly starting to return to Beijing. I'm at the Beijing train station. And in a Chinese context, there are very few people here. The Transport Ministry said that the Lunar New Year travel for this period was down significantly. Overall trips by 16.5%. And for January 30th, the day when originally people all thought they were going to be coming back to work, travel was down 84%. This is because the government has been imposing travel restrictions as well as other measures to try to stamp out the virus. And that has been making things very, very difficult on a day-to-day basis for people here. For those of us living in China, wearing a mask is standard practice. It's not a government requirement outside of the virus epicenter of Wuhan, but nearly everyone has one on because they're fearful of catching the disease. Today was supposed to be the first day back after the Lunar New Year holiday when business would return to normal. But the government extended the holiday, so most shops and restaurants are closed. Finding fresh produce has been a challenge. I'll show you. Here, there are a few vegetables and eggs. That's not so abnormal during the holiday, but because of the outbreak, people are eating at home and hoarding, so it's a lot worse. Masks are really hard to come by. I was here the other day and managed to find 3 for $31, but now there aren't any. I've been looking for hand sanitizer for well over a week. So far, I haven't found any, and the store clerk here says that she doesn't know when there's going to be more. This is one of the entrances to my apartment complex, but more and more housing estates, office buildings, and public areas are setting up barricades and temperature checks. This is the compound where the CNBC bureau is. I have to get a temperature check here, too. So my temperature was a little bit on the low side, but still normal. But if I had a fever, he would report me to the authorities. And living here, you get a sense of just how dire the impact on the economy could be. In fact, Goldman Sachs put out some estimates where they believe that their full-year forecast for China is now going to be a 5.4% instead of 5.9%. They also see an impact on the U.S. in the first quarter, but their expectation is that the U.S. will be able to recover in the following quarter, and so the overall impact for the year in the U.S. isn't going to really be a big net drag, they said.
Eunice, I've heard a lot of different numbers that have been bandied about this morning. We're now talking about 10,000 roughly confirmed cases with the coronavirus. I've heard that there's 15,000 plus more suspected cases, but then another 100,000 people that are being monitored. You just talked about how you were being monitored with your temperature. They would have had to report you to the authorities. Where would you wind up if you had a fever and were reported to the authorities? Would you be in the 100,000 people being monitored? Would you be sent to the hospital?
Yes, potentially in quarantine. So for it hasn't been standardized yet, but for a place like the subway, the people at the subway told us that if you were running a temperature, they would call an ambulance and have a team take you to the hospital and then quarantine you. So, but then in some other compounds, they would just turn you away. And so the procedures actually haven't been standardized yet, but it's possible that they could be, because at the end of the day, they just want to make sure that people don't go out and don't infect anybody else.
You know, we talk about the mortality rate. I think there have been 213 deaths so far from this. They estimate that the mortality rate is somewhere between 2 and 3%. That's much lower than SARS, which was closer to 10%. But if you try and compare that to the influenza, the regular strains that we see here in the United States, there's something like 15 million people who have gotten influenza here. 8,200 have died. That's a mortality rate of, I believe, 0.005%. So you are talking about much larger numbers. If it was a 3% mortality rate on 15 million people infected, you'd be talking about 450,000 people dying. That's why this is so concerning. What do the authorities say at this point about whether or when they think they might be able to ring fence this, when they can kind of get some control?
They're hoping that they get control as quickly as possible. In fact, the premier had told scientists that he was very hopeful that they would be able to really be able to find the root of the virus. It's so difficult to know. And because there are so many unknowns right now, and you put out the death rate, people have been questioning that death rate because there's been a lot of speculation that maybe there's been underreporting for some of these numbers. And so maybe the death rate isn't so accurate. And all of that is just adding to that level of fear here. Again, one of the reasons why everybody's wearing masks, because people just don't really know enough about the virus, even though, when you just look at the straight numbers of the confirmed cases versus the reported deaths, the number doesn't look as scary as, say, SARS, which is very vivid in people's memories here.